Heart disease is the #1 cause of death in the United States. The National Heart, Lung, and Blood Institute, the NHLBI, which provides leadership for a national program in disease of the heart, blood vessels, lung, and blood resources, and sleep disorders, funded this project to help African Americans prevent heart disease. This web-based training session, being conducted by the project team at Morehouse School of Medicine, will help community health workers, CHWs, like you learn the risk factors for heart disease so that you can help to educate other community health workers and clients. I am also encouraging you to participate with other community health workers in the online discussion forums that will be available in the virtual classroom as well. There are a total of 10 web-based sessions that you will cover during this training. If you are also participating in the Learning Circle discussions, these sessions will be taught in more detail in the classroom. The sessions are Knowledge is Power, Know Your Risk of Heart Disease, Act in Time to Heart Attack Signs, Get Energized, Say Yes to Physical Activity, Help Your Heart, Control Your High Blood Pressure, Be Heart Smart, Keep Your Cholesterol in Check, Embrace Your Health, Aim for a Healthy Weight, Protect Your Heart, Take Good Care of Your Diabetes for Life, Make Heart Healthy Eating an Everyday Family Reunion, Eat in a heart-healthy way, even when time or money is tight, Take control of your health, Enjoy living smoke-free. There are accompanying handouts and picture cards for each session to be used when you are teaching these sessions to other community health workers or clients. Handouts are available at the end of each chapter of your manual. Electronic copies are available by clicking your mouse on each handout title. Hello and welcome to the 10th session of the Peer-to-Peer Training and Community Health Workers to Improve Heart Health Project. Take control of your health. Enjoy living smoke-free. By the end of this session, you should know how cigarette smoke harms smokers, how secondhand smoke harms people who are near smokers, and tips that can help smokers who want to quit. When you are teaching this session, you will be referring to 8 handouts for this session, located at the end of session 10 of your manual. Smoking harms you on page 328. Smoking harms infants and children on page 329. Cost of smoking on page 330. Be smart about your heart. Control the ABCs of diabetes on page 331 through page 333. Smoke-free family sign on page 334. Tips to quit smoking on page 335 through 336. Help your heart, don't smoke on page 337. And finally, break free from the smoking habit on page 338. Electronic copies of handouts are available by clicking your mouse on each handout title on the sidebar located on this page. There are many reasons to quit smoking, or not even start smoking in the first place. Let's go over some sobering facts about smoking. In the United States, about 440,000 people die every year from smoking-related diseases. That translates to about 1 in every 5 deaths are smoking-related. The cost of health care due to smoking are about $75 billion each year in the United States alone. More African Americans die from smoking-related diseases than from car accidents, murders, AIDS, and drug abuse combined. Even with those facts, about 1 in every 4 African American men smokes, and about 1 in every 5 African American women smokes. What causes smokers to use tobacco regularly and find it difficult to quit is the very addictive drug in tobacco named nicotine. Smoking does not only harm the person smoking, it can also harm the person's children, family, and friends. Smoking can also affect a person's health in a number of ways. Smoking can result in heart attacks, stroke, cancer, asthma attacks, Yellow stains on the teeth and fingers, bad breath, gum disease, early wrinkling of the skin, decreased sense of smell and taste, and chronic obstructive pulmonary disease, or COPD, such as emphysema and chronic bronchitis. 3 out of every 4 African American smokers choose menthol cigarettes over regular cigarettes because, to some, the menthol tastes better. The menthol cigarettes feel cooler when you inhale. The menthol may make the smoke feel less harsh to the throat, and some even believe that smoking menthol cigarettes is safer to their health than smoking other types of cigarettes. It is also important to know that menthol cigarettes are just as harmful as regular cigarettes. Menthol cigarettes have extra chemicals that make it easier to inhale more smoke and hold it longer, causing more of the harmful toxins in cigarettes to enter the body. Smoking can be harmful to infants and children. Even though infants and children are not smoking directly, secondhand smoke is very dangerous. Pregnant women should not smoke because it will affect their baby's health and well-being. You may have noticed that many smokers first began smoking as teenagers. There are many reasons why a teenager may begin smoking. It may be from peer pressure and wanting to be like their friends. They may be trying to look older, want to be like celebrities, or they may be influenced by advertisements that make smoking look cool or glamorous. Teens may also begin smoking because they may want to imitate their parents or other family members who smoke. They may be rebelling against their parents, or they believe that they cannot be harmed with smoking. Sometimes tobacco companies offer gifts that teenagers may like. Every day, about 2,000 people under the age of 18 become regular smokers. That is nearly 750,000 teens per year. African American teens start off with lower rates of smoking than other racial and ethnic groups. But by the age of 18 to 24, 40% of African Americans have become regular smokers. Young people who smoke may find it difficult to play sports since smoking causes shortness of breath and dizziness, and chewing tobacco causes dehydration. It is important for young people to know that the use of spit tobacco causes cracked lips, white spots, sores, and bleeding in the mouth. People who start smoking at a very young age are likely to smoke all their lives. The longer a person smokes, the more likely they are to develop the problems caused by smoking. Young people who smoke cigarettes are also more likely to try other drugs, especially marijuana, and it is illegal in all states to sell cigarettes and other tobacco products to persons under the age of 18. Smoking also uses money that could be used for other things. Here is a list of things that you could be spending your money on rather than spending it on cigarettes. Even if you do not smoke, secondhand smoke can be dangerous. Secondhand smoke is the smoke you breathe in from someone else's cigarette or cigar smoke. Secondhand smoke contains poisons such as arsenic, cyanide, ammonia, and formaldehyde. Breathing it may cause eye irritation, nose and throat discomfort, headaches, and coughing. Secondhand smoke causes nearly 1 in 10 smoking-related deaths. Each year, about 3,000 non-smokers die of lung cancer caused by secondhand smoke. Infants and children who live with someone who smoke are twice as likely to have respiratory illnesses, bronchitis, and pneumonia, and secondhand smoke can trigger an asthma attack. There are so many benefits to quitting smoking, like living longer with better health, lowering the risk of heart attack, stroke, cancer, and respiratory problems, improving the chances of having a healthy baby if you are pregnant, better health for the people around you, extra money to spend on things besides cigarettes, no morning cough, and better smelling clothes, hair, breath, home, and car. Quitting smoking can be difficult, and it is important to recognize that there are situations that triggers the urge to smoke, like drinking coffee, drinking alcohol, talking on the phone, watching someone else smoke, attending social and community gatherings, feeling stressed and feeling bored. The good news is, once you have recognized the situational triggers that affect you, you can overcome the urge to smoke by finding other ways to relax, keeping busy, keeping moving, and knowing what to expect when it comes to withdrawal symptoms. Your family members and friends can help smokers quit by saying positive things such as, "Quitting is hard, but I know you can do it." Persons who are trying to quit smoking should stay away from other smokers in the beginning of their journey until they learn to resist triggers and urges. Smokers should choose a quit day soon after deciding to quit smoking. Choosing a special day, such as a birthday, can be a good motivation. Now that you have completed this session, do you have any questions? Is there any information that is unclear to you or difficult to understand? What information covered in this session do you think community members may have difficulty understanding? Are there any issues particular to women that should be highlighted in this session? What information covered in this session do you think may be a little challenging for you to present? Why? You will have an opportunity to share your responses with other community health workers in your learning circle discussion and on the online discussion forums.